Our guests are Sara Howard and Susan Hurley, both of whom are doing important advocate work for healthcare reform. Sarah's with Illinois Maternal and Child Health Coalition, and Susan's from Campaign for Better Healthcare. And you guys are being extremely helpful and informative. So we were just talking about single payer or what that is. I'm going to interrupt you and say, what is Ted Kennedy's thing? Is it single payer, or do you know?
I don't know.
Well, Senator
Is it-
Kennedy is on the Health, Education, Labor, and Pensions Committee, and they're going to be hugely involved in whatever kind of reform happens or is passed.
Right.
I'm not sure what sort of specific legislation he's working on.
Mhm.
We have briefs available from our website about what the Senate Finance Committee is talking about, and there are multiple options they're considering, and that's why it's important for people to weigh in and really say, I want access to health care for all. Because members of Congress need to know that it's important.
All right, so let's start with the what can people do thing. Both of you just refer to both your websites or where people can get information on the programs, and then specifically, really, let's tell folks what they can do. Should they go to Springfield, or should they just call their guy and gal? Give us some pointers on how to be active in our own behalf for healthcare reform.
Well, Susan and I both work on a project called the Healthcare Justice Campaign, which is a grassroots mobilizing effort to get people not only educated on what's happening in healthcare reform, but excited and willing to move their legislators in the direction that we need them to go, which is towards broader healthcare reforms, more access, affordable healthcare. And I'm actually the organizer for this area, for Rogers Park and northern Chicagoland. And what we're doing is we're starting out with a series of trainings on the Illinois insurance programs, as well as an update on what's just happened in Springfield and what's going on in the broader federal scene of healthcare reforms. And you can learn more about that at www.ilmaternal.org.
ilmaternal.org.
Perfect.
Okay, and where they would look on that site is the healthcare justice, or it'll just be clear when they
It'll
get there?
say under upcoming events, All Kids and Other Illinois Insurance Programs Training Tour.
Oh wow, I got trained to do all kids when I was working as a community liaison.
Oh, that's wonderful.
I signed kids up.
It's a great program.
It is a wonderful program.
And every session we have to work hard to make sure that it stays
Mm-hmm.
covering all children. We
One
don't
good thing
get rid
that
of
the
any
former
kids.
governor put into being,
Mm-hmm.
and one of a few good things. Too bad for him. Whatever. How about you, Susan? Do you have a call to action here, or even just a website for information that folks can go to?
Sure. Our website is cbhconline.org.
cbhconline.org.
Right. And there are a few things you can do when you visit. One is we have town hall meetings like the one we had in LaGrange happening statewide.
Mm-hmm.
We will be continuing to try and do that over the course of the summer as Congress continues to debate legislation, draft legislation. We want to engage the community as much as possible.
Are you doing any in the city
I think that
proper? I know there was a couple.
we don't
in the
have
winter.
any dates for anything, but I feel like by the end of the summer, I think there will be some things definitely happening in the city of Chicago with ourselves and coalition partners as well, I'm sure.
Mm-hmm.
So the other really helpful thing is just sharing your story. Katy, I think you mentioned that you don't have health insurance.
Yes, I did.
And just sharing your story.
I can't do it until I can offer it to all the employees at the Heartland.
Right.
I cannot. And I
Wow.
can't do that right now.
And it's so important that your legislator knows the difficulties that you're having as their constituent,
Yeah.
because a lot of times they say, "Oh, we don't hear from the people we represent about this
So
issue."
that's something that going out to all the people who have
Yeah.
the radio on, you should be doing, even those of you who listen in different states, and I know who you are. This is a national problem. This is going to be a national issue all summer long, and we have to speak about it.
And so if you go to our website and find the Share Your Story spot, you can just kind of type in a few words, whatever you want to say about what your experience has been. And that we can share with the media with your consent and permission, of course. That is something that we can put in materials to help educate people. That's something that we can share with the legislator that we're working with so that they understand the scope and the human face on this problem, which is so important. It's a very effective means of advocacy and very simple to do.
Right, right. And I do know, like I mentioned earlier, I get a lot of emails from the Obama campaign and the Organizing for America aspect, which is the activist part, trying to support him into passing, support his work to pass health care reform this summer, which is, I think, the objective.
The goal.
And one of his things is a lot of the reduction of paperwork thing. And did they already? Is it my error? Or did they already sign that into being that the reduction of paperwork with insurance company or the national health has already passed? No, you don't. You guys don't know about.
I know that about a week or so ago, Obama did a press conference with other organizations and leaders of major stakeholders in the healthcare system, providers, health insurers, drug companies, others, and they talked about some early consensus points. One of them is what you mentioned, simply reducing cost and increasing efficiency by having electronic medical records.
Right.
I don't think that legislation is passed.
Okay. All right. Well,
but I think it would be likely.
So the two things that you want people to do, say them again. Sarah?
Attend one of the trainings in your area. The closest one, I believe, is up in Evanston.
That's
at the
close.
Evanston Public Library on the 17th of June. And we're working with Health and Family Services to do an overview of what currently Illinois has in terms of health insurance plans, as well as talk about what happened in Springfield this past legislative session and what's going on the federal level. And you can log on to www.ilmaternal.org to find out more about those programs. And they're free to the public, and they're going to be wonderful.
That's great. A training
Yes,
on
they
June
will.
17th in Evanston. That's close enough for us.
I
And
know
how
I'll
about
be
you,
there.
Susan? What else would you like to let people know to do?
Well, you can always volunteer. You can share your story on our website, which was cbhconline.org.
And you can always donate, too.
You can
That's
always make a
helpful.
donation at
Very
that
good.
same spot,
Very good.
even if it's $10 makes a difference.
It makes a big
Absolutely.
difference.
Absolutely. We
Another
don't
thing
talk
that's
about
good
money on the radio, though, but
Right.
that's okay.
I'm sorry.
That's okay. It wasn't an admission thing. It's just a suggestion to donate is okay.
All right.
Yeah.
I was also going to make sure that people know that we have a 800 number where we can help you find medical services,
Oh, that's very important.
and that is 888-544-8271. That's our healthcare helpline.
Well, good for you. That's something that I never heard of. Finding Healthcare, 888-544-8271.
That's the one.
I'm really glad you guys made it to the show today. And
Me too.
Thank you for having us.
I would invite you back. I am inviting you back to celebrate the victories that are ahead.
Yes.
Because that's all we can afford is victories.
That's right. Absolutely. I would recommend that once we have a piece of legislation we really want to support, we get together then. And then we
Absolutely.
celebrate,
Absolutely.
in the heartland.
Well, thank you so much, Sara Howard and Susan Hurley of Illinois Maternal and Child Health Coalition and the Campaign for Better Health Care. You guys are doing really important work. Thank you
Thank you,
so
Katy.
much.
Thank you for having us.
Let's hear it for these gals. Go healthcare.